gaze fixation. This is a great place to start. Again, the definition of gaze holding or gaze fixation is to hold an image steady while your head is steady. Okay. Now, if that system is impaired, we're primarily going to use the VOR to restore it. That's just our best bet, our best option. If that's broken, it's not working, you have to find something else that might work. And you may have to do pursuits or something like that because you've got some gaze holding ability. But that's got to work too to use it. You always have to find something that works to fix something that doesn't. You also got to be mindful that impaired gaze fixation is non-specific. You know, we can't say there's only one little area in the brain that's affected when this system's not working well. So the options that you have here are, let's just say that gaze fixation is off and we did our test and we find that it's when we look to the left, you know, that there's more of a problem. Then you want to make sure that you're going to do this VOR exercise, this no motion, when you look into this area that's problematic. You can also use this strategy if you're looking at pursuits and you're finding that there's intrusions, but they're really happening only in a very specific area. Let's just say it's just the middle. You know, you could do a pursuit and stop in the middle and then do a no exercise. Or you can just simply do your gaze exercises and just do them in the center. You know, look in the center. And what I like to do, naturally we have a gaze stability application I'm going to show you, but what I like to do in most cases, I use this little poster, and this is dry erase. So sometimes I've had to draw really interesting things on there to keep the children's attention especially. But these glasses here have a laser, and we can do laser guided. And the cool thing about them is that the laser is mounted onto the glasses, so you don't have to play around with making sure it's lined up right in the right place. It's in the center every time. And so that way we can do our exercise and do the no, but it's laser guided. So you know that as you're moving, that you're moving on plane. So the options are, we can do a yes motion or we can do a no motion. You know, which one do we pick? Well, and we can do it while the eyes are looking in the center, or we can do it while the eyes are looking to the right or to the left or up or down, you know. Which one? Should we just do them all? And sometimes, you know, doing all of them is good and ideal. Maybe there's not a specific area that's more problematic, but they all are. Maybe the pursuits are rough all the way through, or gaze stability is not good in any of the positions, and you might have to do them all. I would encourage you to really reinforce the ones that are a problem first. But if you don't really have one and you want to do this too as a simple exercise to benefit spinal health, because if you do gaze stability exercises for your chiropractic patients, you know, let's just say while they're waiting, they come into your gaze stability station and they do their exercises, and they may do no-nos and yes-yeses, do a handful of them. I rarely, if ever, do more than 10 reps, but I often will start with lower reps. I might have them do center, right, left, and start small and expand over time. And so I'll have them do that. And if the patient's healthier and have a greater level of function, we can do it standing. You know, but the laser allows you to make sure that your head moves in the right plane. Because if you do a no exercise, but your head tilts with it, then your brain is not encoding a linear movement. So as you're doing this to improve stability in this horizontal plane, let's say the intrusions were moving your eyes, you know, more to one side, then a no motion may be very beneficial. If the movement, let's say your eyes are struggling to the left, and you're doing this leftward VOR motion, so as I'm looking over here, you want to make sure that you're reinforcing on that plane, because this will translate to improve pursuit motion and saccadic motion as well. And so you want it to benefit. So let's just say that you're doing a horizontal pursuit and you got all these intrusions in there, well, this exercise can help improve that smooth pursuit as well. Okay, so you want to make sure that it's linear and straight, and the laser helps with that quite a bit. If I find, let's say that you can see at bedside the direction of the drift, or you've got a system like a right eye system and you can see the tracing and you see the eyes, let's say they're moving down on the horizontal pursuit, you see these downward beats. Well, you can do a pursuit motion and stop. I'm going to go ahead and play that. But pursuit motion, stop, and you can do a anterior pitch exercise that pushes the eyes up in the areas where you're getting these downbeats. And the way that we do that, let me show you real quick, is you can go to this gaze stability feature in settings. And what we want to do, so let's do reset all. So we'll start from remove all these. Okay. So what I'm going to do first is you want to add steps, okay? You want to add steps, and my first step will be right in the center. I want to start from the middle, okay? So I'm going to go to 5. And then I'm going to go from 5, I'm going to go to 6, okay? So I'm going to do the horizontals first. And you can select what kind of target you want, just like all the other options we have. And we'll just make it random. The nice thing about random is it keeps it more interesting. You don't know what the target's going to be like next, so it keeps alternating. And you can make that initial pause hold. You know, and so you've got some option of how long you want it to hold. And we can do tap as an option. That means it won't move until you tap the screen. Okay, so let's just select tap here. Okay, and we can control the final pause. So I'm going to keep that final pause here. We'll make that tap as well. Actually, I'm going to keep that at no pause, and the reason for that is because the next motion I'm going to put tap as the initial movement. And that way it'll just stay in position until I tap the screen, and then it'll start moving again. Okay, you could, if you wanted, if you knew that there's a specific amount of time that it takes your patient to do their gaze exercise, well, you could just put in a certain amount of time and it'll just start moving automatically. If you don't know, you don't want them to be rushed, then the tap feature is really great. Okay, so then we've got that, we'll hit done. We've got our first step, and we can control if we want these targets to be close together or further apart. It's just like our gaze chart right here. Closer together or further apart. So right now they're set at 50%. Okay, so you can do 50, 25, 50, 75, or 100. So we'll leave it at 50 for now. Let's just add another step. Now we went to the right, now we're going to go back to the left. So from 6, we're going to go back to 5. Okay, and we're going to do initial, we're going to do tap, it's all the way at the bottom, and no pause on the final. The pursuit speed is 5. So I decided that I was going to use pursuits from one point to the next. It's good to pick something that works well. So in your assessment, if you find that, you know what, their saccadic system works so well, maybe we should do saccades. Or the pursuit system works well, but the saccadic system doesn't, pick the one that works the best. Or the one that seems to be most beneficial. Maybe after a saccade, they have better gaze stability than they do after pursuit. I don't know. So those are options that you have. If we were to pick saccades, for example, and I usually do one or the other, but let's just say that we did express saccades, right, with the gap feature, meaning one target disappears and the other one reappears. And I can pick how many movement I want between that eccentric position and that center position. So let's just say that I wanted to make it 2 movements, okay? And the amount of time between each motion, I'm going to make it, let's just say 3 seconds. We'll do 2.5 seconds. Okay. 2.5 seconds. Because maybe in this case, I've got these downbeats, these drifts downwards, and I want to do a yes motion every time because maybe those downbeats are all the way through my horizontal pursuit. And so now just pursuit to the right, but I realize, I'd rather do a yes motion every time. So in this case, if we play this out, final pause, let's make it pause for a few seconds when it finishes. All right, so initially, if I wanted to save it, I would do save as, and you can save that, and it'll go directly into your home folder. From the home folder, you can then move it to other folders, but everything you save goes in the home folder, and then from there you can move it to other folders. Okay, so we'll do it this way, just for so you can see what we have so far. So here I start in the middle, and I may do my exercise. I may do a yes or a no motion, whatever you determine is necessary, and then I'm going to tap and I'm going to pursue all the way to the right. And now that I'm in this position here, it won't start moving until I tap the screen. So I'm going to do, again, my yes, yes motion. Maybe I have those downbeats, right? So I'm going to do a yes motion, that anterior pitch movement to push my eyes up. And then I'm going to hit tap. And you're going to see a target motion. And I'm going to do a yes motion and move again and a yes motion. Okay, that was kind of fast. But you want to give yourself enough time to do at least one movement. And a lot of times that's all I do is just one motion, one high quality movement with each movement. Okay. Now we can change those settings. We can keep adding steps so that we can go to the left as well. If we feel like that's necessary, we can go back to the center and then go back to the top and down. You can direct it in any of those positions that you want. So that's for gaze stability. Now I want to show you too, I talked about saving an exercise. If you save it, it'll automatically go into this home folder right here. And if you want to move it to another area, you can, let's say, create a new folder. We'll do add a folder. Here's your new folder. If you click on it or touch it, you can change the name of the folder. And there's nothing in there right now. So let's just say I wanted to move something from my home folder, and I don't have anything in this one. Okay, so let's just say I want to move something from my sample presets, and I want to move, let's say, this first one right here, left parietal pursuit. Okay, so it's in sample presets, selected to move home, but I could move it somewhere else. I could move it to my new folder. Okay, and then I'll hit done, new folder, that's where it's going, and I hit done, and it moves to the new folder. Okay, now it's in here. I can rename this folder. If I wanted to call it just new or NE or just N, whatever you want, you can add. But there it is. So if I want to move it back, I can go here and put it back in my sample presets and then done. And by the way, you can delete the folder right here if you choose to. Now it's back in my sample presets. So we did the bedside exam earlier, and you'll notice that this run in sequence is selected. Run in sequence will basically make everything in your folder run one after the other without having to go back here. Okay? And this is useful if you're creating a new folder and you want your patient to run through a sequence of exercises in order, it'll do that. Now, if you wanted to move things around too, you could. Let's say that you wanted to change the order that things are in. What you do is you touch the name and then you press on, hold it, and then move it down. And then it'll move it into a different position. Okay, that's how you can change the order that things are placed in. And then you can do run in sequence. And if I were to start here, it'll run through all of these. And when one finishes, you know, when one is done, let's just say, I don't know how long these are, but when it's finished, it'll say complete, you'll press complete, and then you press start, and then the next exercise after that goes. It's just like we had it in the exam. But again, I don't remember how long this goes, so we're just gonna zip through that. All right, so we covered gaze stability. Now, there's a number of different kinds of interruption in stable gaze or disruption in normal fixation. They're listed in your sheet, so you can refer to it. You know, nystagmus is an oscillation of the eyes. These are all different types of oscillopsias, okay? So sustained oscillation, but that's initiated with a slow movement, that's nystagmus. The saccadic oscillation is similar, but it's initiated by a fast movement. Saccadic intrusions are intermittent. They're just fast disruption of gaze. It can happen within a pursuit motion or just steady gaze. And they're intermittent. Sometimes they're there, sometimes they're not. You don't know when they're going to show up. It's not a sustained motion. Peripheral central vestibular dysfunction will certainly do that too. And that's why it's so good to look at gaze stability. And if you've got a right eye system, there is a gaze stability test there. And you can see, are the eyes migrating to down or to the right or to the left, or, you know, which direction are they moving into? And that gives you an idea. Is there potentially a vestibular imbalance that is forcing the eyes out of position? Now, you could see this too if you are with a patient and you just look at them in the eyes as you're talking to them. Just make mental notes. Are they moving their eyes down more than anywhere else? Are they moving to the right or to the left? Are there spontaneous movements in there? Or is there simply just a preference? They just, for some reason, they feel comfortable keeping their eyes over here when they're talking over there. This just feels right for them. This is where they want to be. That's valuable. You know, you might suspect that there's a vestibular imbalance and that's moving the eyes in one position or another. Down is really common. You know, a lot of people will look down when talking, and it's just hard, and maybe they'll come up and then they'll go right back down. You know, and that's, you know, again, it's really common to have that overactive posterior canals. They push the eyes down. When you move the head back, the posterior canals move the eyes down. When you move your head forward, the eyes get pushed up. When you move the head to the right, it gets pushed to the left, you know, and that's what they do. So if you've got this downward preference, you know, you want to use some of those strategies that we talked about. Maybe you'll do more upward movements exercise. Maybe you're going to do just an anterior pitch, yes, yes motion to really force the eyes up. You know, if you've got a preference to the right, well, you're going to use a strategy that will move the head to the right and the eyes to the left. So maybe eyes will stay center and you'll do just a right motion, you know, just a right motion, just to force the eyes there. If the eyes really like hanging on that right side, you know, you want to use either a ×1 or a ×2 motion. A ×1 is, this is ×1. A ×2 motion, the eyes, as you move the head to the right, the eyes are going to move as well to the opposite direction. A ×1, it's staying fixed on there, okay? And then a ×0 is when they're going with it. So if the eyes like being here, we can say that the left horizontal system is stronger, right? Because when you turn head left, eyes get pushed right. That system is stronger. So we want to do a ×0 to suppress that system, and then we're going to do a ×1 to activate the other side, okay? So ×0 suppress, ×1 activate. So suppress left, activate right. That's just a really good strategy to bring about some balance there, okay? So that's it for gaze fixation. Let's move on to the next one.